Hi, I'm Randy Golden, and I'm with Medical Technologies of Georgia. I'm here today to introduce everybody to Cath-Lean, the first and only closed system catheter designed especially for women. From the compact package to the catheter and bag that are actually specifically designed and sized for ladies, Cath-Lean is 100% for women only. When we designed Cath-Lean, we took packaging into consideration as well. In my left hand, you see a standard size package. In my right hand is the Cath-Lean. And you'll notice that this will fit easily in your pocket or purse, and you can actually put this between your back and your seat rest in a wheelchair. You can bring them along anywhere. So let's take a look at what's inside the package. We have a pair of cuffed, folded, latex-free gloves, a gauze tissue that we're going to use to clean up afterwards, 2 antiseptic preps, BZK, which are clear and not iodine and won't make a big mess. We have our privacy bag, which I'll describe in a minute, and then the catheter. This is our 14 French version. We actually make this in a 12 as well. And just open her up here and show everybody. The bag does a couple things. It protects the sterility of the catheter, and it's also going to catch the fluid once the urine starts to flow. Okay? The catheter is pre-lubricated, so that step's been eliminated. Once I take the cap off, I expose the introducer tip, and I'll talk about this in just a second. The introducer tip is designed to get the catheter past the vast majority of bacteria that are located within the urethra. Studies show that in men, women, and boys and girls, it's kind of all the same. Most bacteria right when you first go in. If the catheter goes through this region unprotected, it can literally push those bacteria further into your body. The introducer tip protects the catheter from those bacteria located within the distal urethra. When I advance the catheter at 1 to 1.5 inches at a time, as you can see here how this works, the catheter comes out of the bag, I never touch it, and the urine is going to eventually flow right from the catheter into my bag, so I can literally cath anywhere. I can be on a plane, in my car, at work. I don't have to be in the bathroom. If I get to my grandmother's house and I can't get in the bathroom because my chair won't fit through the door, I can cath over in the corner with Cath-Lean. It's very important when removing the cap from either Easy Advance or Cath-Lean that we gently pry the cap off the introducer tip in this manner. Let me do this again and I'll show everybody. So the cap is secure. When you take the cap off, gently pry it away, just like so. What you don't want to do, you don't want to pull the cap in an upward manner as I'm doing here. And the reason we say that is you want to make sure that the introducer tip is not removed from the bag. So again, this one here that's now in my left hand is correct. I'll show you one here that we have taken the introducer tip completely off of. The one in my right hand you would not want to use. You can actually look down inside and see that the advancer valve is exposed. The introducer tip is removed. If you encounter a bag where you've taken the introducer tip completely off, discard this one and get another. MTG's catheter eyelets or drainage holes are fire polished, so they're less likely to cause irritation as the catheter winds its way through the urethra. We also have a conical tip which helps the catheter pass through tight spots along the way. Now I'd like to show everybody how to use Cath-Lean. Of course, anytime you catheterize, wash your hands before and after catheterization. The first thing I'm going to do is I'm going to take the cap off and expose the introducer tip. And now I'm going to set the catheter in my sterile field and just get it where easy access availability there. And with my left hand, because I'm right-handed, I'm going to spread the labia, and I'm going to do everything else with my right hand. I'm going to go to my antiseptic wipes, and I'm going to take each one of them, and I'm going to wipe downward one time to clean the area prior to catheterization. This is a benzalkonium chloride. Again, it's not iodine, so you don't have the issues associated with iodine. Insert the catheter and the introducer tip in the urethra, and then hold everything stable just like this. It should look just like this with the patient as it does in my hands. Now, one thing that's really important is to make sure that the MTG logo is facing up. You don't want to have the bag upside down, because what's going to happen is once that urine starts to flow, there won't be any place for it to go, and it can literally come back on our patient. So, always have the bag positioned parallel to the leg with the MTG logo facing up. Okay? Now I'm going to give the catheter 2 pushes. 1 push, 2 pushes. I'm in the bladder. I'm going to straighten the bag and allow the urine to flow down into the sac. When she's finished, and I don't see any more fluid, I'm going to pull the catheter out about 1 inch. And when we don't see any more fluid at all, I'm going to let go of the patient, and I'm going to reach back and grab my gauze tissue, and I'm going to pull the catheter completely out of the body, and I'm going to use that gauze tissue to catch the eyes as the catheter does leave the patient. I'm going to measure and record output, and if I were to let go of the bag, everything's going to stay stable because it all stays together. We have a locking flange in there that keeps everything from separating. Now, if I need a sterile sample, I'm going to go over to the toilet and I'm going to entwine the catheter just like this with my left hand. I'm going to hold on to this pipe inside the bag with my right, and I'm just going to pull the catheter out the top of the bag, expose the sample port, pour the sample off into a receptacle, send it off to the lab, and I can pour the urine from this port. If I'm in a hurry, I can tear the bag. There's a little perforation on the other side which allows you to tear the bag and empty the urine more quickly. And then finally, when I'm finished, I'm going to go back and get my privacy bag. And the privacy bag is included with all Cath-Leans. When the patient's finished voiding, open the bag, discard the catheterization supplies. There you go. And we even have a little handle on here to make it easy to discard. So, to learn more about MTG Cath-Lean, please visit our website, medtechga.com, where you can also order free samples.